As flu season approaches, the Centers for Disease Control recommends that everybody 6 months old and older get a flu shot. Young adults last year were one of the hardest groups hit by the flu, and they were also the least likely to get their shots. Dr. Paul Schultz, who is head of infectious diseases for Norton Healthcare, says the sooner you get your vaccine, the better off you'll be.
Recommendation for who should get a flu shot is pretty straightforward. It's anyone over the age of 6 months. There's relatively few contraindications to who shouldn't get a flu shot, and it usually has to do with allergy or previous serious reaction to any component of the influenza vaccination. So for children, there is one preferred vaccine for healthy children aged 2 to 8, and the CDC recommends that they get the FluMist vaccine. And the reason for that is that in several studies, the efficacy has been improved or better with the nasal vaccine than the shot. The recommendation to get vaccinated is clear. Obviously those folks are over the age of 6 months. For folks over 65, there's the high-dose vaccination that's available. The CDC doesn't make a preferential recommendation this year, but we do have a lot of elderly folks that want to get vaccinated with the high dose, and we have that available for them in our offices. So the recommendation typically is to get vaccinated a couple weeks before influenza season starts. The problem is we never really know when that's going to be. We have had a couple cases here in the community already, so we're actively trying to get folks vaccinated, not only in our offices, but in our employee health program, and now's the time if you haven't been vaccinated. You can get the flu if you've been vaccinated. It's not 100% protective, but it does significantly reduce your risk of getting influenza. Recently there's been these fears over autism and other adverse events from vaccination in general. The autism thing was actually debunked and proven not to be true, and why other people don't get vaccinated is kind of a mystery. But the one thing that is true, the more people in a community that get vaccinated, the more protection there will be for the community as a whole. This is what we call herd immunity. And it's different for different diseases, but usually you want to try and achieve at least an 80, hopefully more like a 90% vaccination rate to achieve that herd immunity.
You can get your flu shot from your primary care provider or any Norton Immediate Care Center. For the immediate care center nearest you, go to nortonhealthcare.com. Piece of cake.